Hi, Dr. Reagan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
We train on what that scan should look like until they're doing scans and they're doing a much better job than I am. Why? Because that's what I want. I want to train them to do dentistry the way I want it, to have it done in my own mouth.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, this is Dr. Bruce Baird with the Productive Dentist Podcast. And today I wanted to talk about, because I get this question all the time, is how do you train your team? I mean, how do you get your team trained? And I look at that question and I get it kind of across the board. How do you train your front office? How do you train your treatment coordinators, office manager, across the board? How do you do the training? And the thing that I think is important is, because I hear all the time, I just don't have time to train. We're so busy. Well, that would be a lot like a football team never having time to practice, or a golfer on the pro tour never having time to go hit balls. And to me, if you want to produce at the highest levels in dentistry, you've got to have a team, and you've got to have a team that is amazingly trained. And not just trained, but trained the way you want things to be done. I hear it also all the time. I hired this person. It's the way I was early in my career. I hired this person to do a job and be a treatment, coordinator, or to assist in dentistry. And they've got experience, but they don't know what they're doing. Well, they don't know what they're doing because every dentist is different. Every dentist works differently. Oh, I hired somebody to do my accounts receivable. Well, okay, but do you really know what they're doing? And so that's, some of those areas is where coaching can really come in and play a major role. But you have to be the leader. You have to be in charge. You're the one who has to determine what it is that you want them doing. Otherwise, you're going to spend your career just like I did my first 15 years, which is disappointed. Because people weren't doing what I thought they should be doing. And what I found out was it's because I never told them what I expected. So let's start out first. Let's look at the overall office and saying, how are we going to do training for our entire office? We like to have a team meeting once a month, couple of hours. Early on in my transition into training my team, it wasn't unusual for us to do a half day or even a full day. And what happens is, as you get team members that have been there for 10 years, 15 years, well, you can start to back that off because your training has been accomplished. Now you're looking at fine tuning your team. You're looking at doing those little small things. But initially, I would say, what is, a half a day a month to train team on what you want them to be doing. And another area would be, how do I train a treatment coordinator? I had 4 treatment coordinators who worked with me. And if we ever had somebody, which I kept 3, one for 30 years, one for 20, and one for 10. But whenever we hired a new person, I wanted them to train them. They know how I wanted things done. So I wanted them to train them. I wanted them to give them the heads up on what it is that we do in the practice every day. And because if they're not happy with that new hire, then their productivity goes down. Why? Because they're so worried about that other person. So I put the responsibility on them. So how do I train my treatment coordinators, for instance, my chairside assistants? Well, each day, as we go through the day, I would make notes of things that I needed to help them with. It may be showing them exactly what a provisional restoration should look like. And when I say exactly, you make the provisional, you take the scan, you do it. And we do a lot of CEREC restoration, so we didn't have a lot of temps. But when we're doing a full mouth rehab where we built 8, 10, 12, 14 units of provisionals, I want those to look a certain way, and I want to make sure that my team knows exactly how that's supposed to look. I want those margins polished. I want the entire restorations polished to a high finish so that the patient's not piddling with their tongue on it all the time and driving them crazy. And so I would show them, I would polish it. I would get out the different components that I use to polish that provisional, how I checked the bite, how I looked at all those things. Ideally, I wanted to have some anterior guidance in those to disclude the posteriors, but every case is different. And so I would visit and talk and show, and I'd spend time in the laboratory. So your appointment times are going to be a little longer when you're training, but you want to train this and you want to do it. Let's say I'm talking about Gay, for instance. One of my assistants has been with me forever. When I first started training her, when she came from Walmart, she didn't know anything about it. In fact, I would almost rather hire somebody that doesn't know anything and then train them on what I want, and do it that way. But I would show her, and then I would come in and check the provisionals. And so when I checked the provisionals, I'd look at it and I'd say, okay, well, let's take those out. Let's take a look. And we'd go in and say, let's go to the lab and let me just show you a couple of areas. In other words, embrasures. I want those embrasures open. Why? I want them to be cleansable. I want those tissues to be able to heal better. So I would actually go through the process, show them, show Gay, how do I separate between the teeth without separating the teeth? Because I want that cull of tissue to be up there, and I don't want it to be pushed out of the way. How many times have you been putting a crown on and the tissue is way up, pushed up because the provisional wasn't right or the temp wasn't right? So I would show Gay that. I would show Summer that. And then I would trust but verify. I would check it, and I would check it every time for a while until finally you're feeling very confident about Gay, and she's doing them daily just the way you want them. Then go back in 6 months and just happen to check again. Why? You want to make sure they're still doing that. And so those are things that, you trust but verify. I train, and I train over and over and over again until I am sure that they know exactly what it is that I'm expecting from them for that, for instance, provisional. An impression, what is that impression? What is that scan supposed to look like? And we train on what that scan should look like until they're doing scans, and they're doing a much better job than I am. Why? Because that's what I want. I want to train them to do dentistry the way I wanted, to have it done in my own mouth. What about an occlusal guard? Do you sit in there and grind on the occlusal guard to get it to where the bite is the way you want it? Well, yeah, many dentists do. Many dentists do their own provisionals. Many pack their own cord. Many do, their anal retentive, and they want to do everything themselves. Well, they're not going to be very productive. I can just tell you that. They're going to feel good about themselves. That's fine. But as far as your team, well, they'd really rather do something besides just suck spit all day. They'd love to be a part of the mission, a part of making a person smile great. And so my way of looking at it was, I want them to be a part of that team. And so as far as an occlusal guard, I show them exactly how I want that. Very light contacts, more in the anterior, so I'm getting this deprogramming of the musculatures in the face, shutting off those masseters, and that's going to help that patient in the future. What you don't want to do is just throw a mouth guard in and say, wear it. Because it needs to do the things that you have planned for it to do. So I would train my team exactly. Then I would say, when you get the bite adjusted, let me come take a look. And I would look at it and say, well, let me just show you that this area way back in the back, round number 2 and number 15, those really fire the masters. If you're hitting here, I don't really want that to be touching. And so we would go through that process. Let's talk about, doing financial arrangements with patients. I wanted this to be something that was standard. This is what we train. This is how we do it. And what we did is we have a sheet that has our financial arrangements on it. Number 1 is cash discount. Number 2, if you have great credit, you can use third-party financing. 3, if you have great checking account history, that's where compassionate finance would come in. So the patient, I would just say, and I would train my team to say, Bob, I'm going to go in sterilization. I'm going to get a couple of things ready, but I'd like for you, these are our financial arrangements that we have for the treatment plan. They've already gone over and said it's going to be $14,000 or whatever it is. If a patient says, okay, 14, that's less than I thought it was going to be. Okay, great. You still want to hand them that form. That form is going to have their option, their discount for paying cash, and it's all filled out in an Excel spreadsheet that tells them exactly what their portion would be after insurance or their portion after discount. And so the patients appreciate that, because it's not about sitting there going, okay, we expect this, we expect that. These are just our options that we have in our office. And so the patient can look at it and say, you know what, I'd really like to do some monthly payments. Okay, great. We've got some, and you have others that say, I don't ever want to do these monthly payments. Well, what does that mean? Well, many times it means they have bad credit. And that's where compassionate finance can come in. You say, well, we have a lot of patients that have been in the same boat, but with this compassionate finance, with a down payment, and looks like your insurance will cover the down payment, or with a down payment of, say, $1,500, we could get all your work done in a single visit. So we're driving that conversation towards comprehensive treatment planning. Now, I love that. And I love having somebody hand me, these are my options. And so that's how we train that. Office manager. How do I train an office manager? Call them a comptroller. Again, whether it be putting all of my data and all the stuff in QuickBooks, but I have to look at those QuickBooks on a regular basis. So I would look at them a couple of times a week, and I would look for anything that stood out to me, maybe a bill that hadn't been paid or bills that were being paid. These are things that I'm looking at very carefully, but I'm also working with my office manager. A lot of times that's an overwhelming position. They get interrupted all day long. They get interrupted, just anytime there's a call that's above, the front desk level of authority, because you haven't given them any authority. They end up calling the office manager. Well, the office manager back there trying to be the comptroller, running that part of the business. I call MBWA, managed by walking around, but they also have emails to answer. They have lots of things that they're doing. So what I do is I structurally set them up. I said, I don't want you to take calls from anybody for this time, from 8 to 12 or 8 to 10 on Mondays and Wednesdays. Do your emails and your responses from 10 to noon. Set up your bill pays. Do your bill pays. How long does it actually take? Well, probably an hour. But when you're interrupted 25 times, it's very frustrating for that office manager. So how do I do that? I set up their business so that it runs as efficiently as it possibly can for them. They enjoy their job much more, and they know what to expect from you. So these are just, a few of the things. But what I will tell you is it's absolutely paramount that you train your team the way you want it done. Otherwise, you're going to spend your career frustrated. I have a great buddy who says, I just can't hire anybody that can sell dentistry. I said, well, until you can sell dentistry, you're not really going to find anybody that can sell dentistry. So those are the things that I look at on a day-to-day basis in the practice. I hope this has been helpful. I look forward to next week. Thank you.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.